Thank you all for being here and taking time out of your busy days. I know we're all very strapped for time, so I'm glad that you're able to join us today to review the GI360. We're going to go through the GI360. I'm going to give an overview of the GI360, the different parts of the GI360, the methodology involved, et cetera. And then at the end, we'll go over a case study, as Angie mentioned. As a broad perspective, my talking points are going to be that we're going to first talk about the clinical indications for gut testing. Why would you do it? Which type of patients would fall into this category? Hopefully, you're thinking about it as a first-line treatment therapy for many of your patients, considering that the gut is, of course, the root cause. Dysbiosis and unrest and imbalance is at the root cause of many of today's chronic inflammatory conditions. So good first line of defense, obviously. We're going to talk about contraindications for collection, or when you shouldn't collect for stool. We're going to talk about collection and how to do that properly. Focus on the methodologies that are involved with the GI360, and then, of course, a case study. Okay. So if you have not seen a GI360 before, this is the presentation page, the first page of the test. What we are offering in the GI360 is bridging the gap, the diagnostic gap here. We're offering complementary identification methodologies, PCR, microscopy, and microbiology to identify pathogens, and to identify a dysbiotic gut versus a normal biotic gut. In addition, the GI360 also offers state-of-the-art stool chemistry analysis, which are also very important markers, and then can also offer susceptibility testing and sensitivity testing to help guide your treatment for any dysbiosis found. All of this provides you clinically actionable results as soon as you get your test back. We are always happy to walk you through a free consult at any point. We try to be very responsive in that regard. So feel free to call us at any point as many times as you need over the weeks and months that you're using the GI360. I also like to remind clients that we do have a website dedicated to this test. It's up at gi360.com. It's apart from our normal Doctor's Data website, of course. This site provides you with about 50 pages within this GI360 resource guide. It's a PDF. It's searchable. So if you want to get specific and really dig into the details about this test, this is perfect for one of those rainy days. It also offers a listing of these different types of GI360. So we would want you to begin with the full-blown panel. I call it the big enchilada. It covers everything. But then if you're interested in breaking out the GI360 into different sections to retest, we also offer variations on the theme of GI360. Up at the website also, we have practitioner videos. We have more than 20 peer-reviewed research articles that guide you into how we came about the design of the GI360 and what it provides for you. So lots of good information. Okay. Why would you want to run a gut test on any of your patients? Well, any of your patients that are experiencing any of these conditions, chronic metabolic conditions like diabetes, metabolic syndrome, of course, immune dysfunction, of course, at the root cause of many of our immune dysfunction issues, mast cell syndrome, chronic inflammatory conditions, any mental health issues with that gut-brain axis interventions, any low soluble fiber diet. So standard American diet, low FODMAP, keto, vegetarian, carnivore, any of these patients are most likely going to be experiencing some level of dysbiosis or imbalance with their microbiome, and who knows, maybe more. Any fertility or hormonal patients, obesity patients, especially those on the GLP-1 agonists, liver, adrenal, thyroid patients, and of course, any patient interested in overall wellness, optimal health. The other patients that you'd really want to monitor and watch with this level of detail that we're giving you is going to be any patient with a known GI diagnosis. So any enteropathogen history, of course, any of the IBS, IBD patients, previous history of yeast, or any other dysbiosis involved. Contraindications prior to, say, taking the collection or using a stool test, this stool test, would be if there is any active bleed from hemorrhoid or menstruation. With that, you might, with that sort of interference, you might get a positive red blood cell result on the test. So trying to stay away from those timeframes would be ideal. Sometimes it's not possible. Any large amounts of vitamin C may cause also that red blood cell false positive. We encourage patients in our instructions that we'll see in a minute not to contaminate the sample with any urine or water during collection. It's only diluting some of the markers that we would want to see as not loose or watery, obviously. Use of anticoagulants, aspirin, large dose iron, NSAIDs, gout meds, corticosteroids may all cause false positives on occult blood. So it's good to know that there are other reasons why you might have positive occult blood. Oftentimes, patients are on some form of supplementation or product so that they have a stool. Unfortunately, those oily over-the-counter laxatives are contraindicated. So what do? We do suggest magnesium citrate, oral fleet, psyllium husk, just to get the stool going, and as you know, any firm stool will work. We can certainly work with a watery stool, but like I said, some of the markers might be affected by that dilution effect. And then we would want you to wait 4 weeks from a colonoscopy or a barium enema before collecting, just so that the microbiome can replenish. Okay, instructions for collection. This is in our kits. We've gone over the other information at the bottom, but prior to collection, we request strongly that the patient, 2 weeks prior, we requested the patient discontinue the following: antibiotics, antiparasitics, antifungals, probiotics, PPIs, if possible, not always possible, and then bismuth. All of these affect the growth of the microbiome, obviously. We want to get back to natural growth, if at all possible. Sometimes the patient can't be off of these medications, and then we would consider it a medicated gut, and we would help you interpret the results from there. 2 days before the test, to avoid these false positives, come off of aspirin, NSAIDs, digestive enzymes, laxatives, of course, activated charcoal, betaine, antacids, etc. Okay. The beauty of this test is we're giving you the best of 2 worlds. We're giving you PCR, and then we're giving you culturomics. So PCR is used in this test for the analysis of the abundance and diversity of key beneficial bacteria populations of the microbiome. So we're looking at the beneficials, using DNA, looking for DNA using PCR. We're also using PCR detection for pathogenic bacteria, viruses, and parasites. So this is our GI pathogens page, our pathogens report that we'll see. We also are offering comprehensive parasitology by microscopy. We have full-time parasitologists in our lab. We don't send anything out. Everything is done in-house, so turnaround is very quick. Stool culture using Malditoff library for the identification and standardized susceptibility testing, which is critical for your treatment plan, of the cultured bacteria and yeast found at dysbiotic levels. So all of that is also offered, along with a broad range of stool chemistry markers. Okay, let's talk about the role of PCR versus culture in detection. Why would you want both? PCR, polymerase chain reaction, is amplification of DNA sequences. The results of PCR are limited to a specific set of probes used. So in other words, in fishing terms, we're looking for a specific fish using a hook. There, we'll find it, even at single digit units. It's highly sensitive and specific, 95% accuracy and reproducibility rate with our probes. We also use PCR, this level of detection we use with our pathogenic bacteria, viruses, and parasites. Our probes are FDA cleared and EU marked. EU is comparable to the FDA here in the US, over in Europe. So that's PCR. Culturomics to detect bacteria and yeast. As you may know, with microbiology, culture is generally considered the gold standard, 100% sensitive. If it's there, we're going to find it and identify it. Malditoff is a library. It calls the genus and species correctly for this found bacteria, fungi, and yeast. Analytic specificity is 100%, and we have a library of over 1,400 genera. So there's a lot to choose from. The isolation of these organisms allows for direct antimicrobial susceptibility testing, which PCR does not allow, of course. We are offering over 195 species of yeast, and 86 of them are Candida. So we have a very wide reach. Culture also allows for the identification of unique species. And it's interesting that actually Doctor's data was successful in identifying a brand new species several years ago called Larybacter Hong Kong genesis. All right, so that is an overview. This again is the first page of our GI360. Above this hexagon shape is all the patient information, the client information, the number of collections of stools that we got, so that would not be important for this representation. The hexagon is representative of the beneficial microbiome. We're going to talk about that here in a minute. Also representative of the beneficial microbiome, below that are two scores, Dysbiosis index and diversity. So we are comparing the findings from the microbiome that we found for this patient using their stool against a normal biotic population, and we score them. So we'll talk about that in a minute. Below that, those scores is to the left, something called GI health markers. These are touch points for you as a clinician. These are 5 different functional guilds within the beneficial microbiome. What is a functional guild? It is a group of bacteria that have the same job. They do the same thing. They metabolize the same way. So it's just good to know if we are deficient or imbalanced in any of these one areas, just as a summary for you again. And then across from that, key findings. This would be, I call it, everything else that we found on the test that was considered out of range. So anything that we cultured, anything that we found under parasitology, anything stool chemistry-wise will be listed here. So as you can see, this is a great summary for each of your patients. This then is going to break down into certain sections of that first page, just so you're familiar. The hexagon shape is 6-sided. It represents the 6 different phyla that we know based on the literature need to be found inside a normal biotic gut. There are many species, of course, in amongst these phyla, but these are the main categories, basically. The patient's results is that white film overlaid on top of the hexagon. We would want the white film to, number one, look like a hexagon. Sometimes it looks like a square. Sometimes it looks like a triangle, but we would want it to resemble a hexagon. And we would like it to fit inside the green shaded area. So that green shading, green is normal biotic. There is low normal, mid-range normal with a sort of a gray bar inside, and then high normal. So anything in green is normal biotic. On both sides of the green is yellow. Yellow would be 1 standard deviation away from normal, either high or low. The red would be 2 or 3 standards away from normal, high. And then there's blue in the center that is 2 or 3 standards too low. So that is how to read this hexagon. All of the findings within that white shading are weighted differently. The membership is weighted a little bit differently. Some members have a little bit more heft than others, but we put all the results from what we find into an algorithm, and out shoots this Dysbiosis index score and the diversity score. So the Dysbiosis index is comparing this patient's results against what would be considered normal biotic. We would want all of your patients to be in the green at a 1 or a 2. Of course, this patient is at a 5. That is the worst score that you can have. So very, very imbalanced. When we say dysbiotic, we mean imbalanced. Doesn't have anything to do with the pathogens, with the parasitology, with the stool chemistries, nothing else. It's just the beneficial microbiome. So realize that. The diversity score is based on Shannon's index. It is an ecological index, and it is basically measuring how diverse the stools, the collections that we got were. How diverse were the microbiome membership that we have identified? So in this case, diversity score, she's at a 3. We'd want her in the green again at the other end of the spectrum at a 4 or a 5. So there's sort of opposing scores, if you will, here between the two scoring profiles. So there is definitely some work to be done with this patient. So in essence, that was just the beneficial microbiome. Again, we're measuring that diversity and abundance. And that all contributes to a healthy ecosystem. This ecosystem is influenced by diet, age, antibiotic use, and factors like hygiene, the living environment, exposure to microbes, etc. So again, not dysbiotic in that there are problems, is how balanced are we right now for the beneficials? And this imbalance is and can be associated with IBD patients, IBS, diabetes, etc. Let's look at these scores. Just a little bit of background. They're based on a verification study of more than 5,000 patients. So we update these every 1 to 2 years. So we're always looking into the current statistics here. We disregard basically any of the higher than 3 dysbiosis index scores. So those are not normal biotic. We are looking for scores at either a 1 or a 2 to include as what is normal biotic. Below those scores, then, let's talk about these functional guilds that I mentioned briefly. 5 different areas that we identify for you. It's just a good added plus to know that we are looking at things from a larger perspective as well. So there are bacteria associated with butyrate production. At least 2 of these butyrate producers would have to be below a healthy range for us to call that imbalanced. So we have guided you in terms of the real specific species that contribute to the butyrate production, the mucosal barrier, intestinal health, etc. All this is available at the website as well. And then finally, the key findings area. Again, it is everything else that we found in this test that was out of range. And we'll talk about that at the case study. So after the summary page, then we have 2.5 pages of a deep dive into our beneficial microbiome. So I'm not going to go into that now. We'll go into that in a little bit more detail with the case study. But just know that there are 2.5 pages, about 45 different constituents of the gut that we look at, including Faecalibacterium presnitzi. We look at Bifidobacterium. We look at Akkermansia, of course, Lactobacillus, Phascolarcto. These are all the members that are sort of larger influence in the gut that we and are happy to walk you through in terms of an interpretation. Just a brief summary about Bifido, very important for the health of the entire microbiome. This is one of the key species, along with Lactobacillus, that we make sure is in normal range. It can be influenced by stress, highly influential with stress, plays a role in many things, including the manufacture and absorption of B vitamins and K2. So if a patient is low in their Bifido, they could also be a candidate for those vitamins. And is commercially available in probiotics. So it's one of our first line of defense against a deficient microbiome. Lactobacillus is next, also available, commercially available, has a lot of uses in the gut. Low lactobacillus can look like IBD, look like IBS in terms of some of the symptoms, but if we can get that lactobacillus back up, some of that does resolve, of course. Important to maintain this species for sure. Faecalibacterium presnitzi. This is within the Firmicutes phylum. It is one of the key butyrogenic species, so primary producer of butyrate. Really important for the protection of the mucosal barrier, intestinal barrier functions, very anti-inflammatory with that production of butyrate. So we watch this and make sure this is of course normal. It is very dependent upon what the patient does with soluble fiber or doesn't do. Akkermansia, also sort of a darling of research right now, known for its association with mucin production and the mucosal barrier in the gut. So we don't want this to be low. Contributes to, of course, the mucosal barrier and repair of that mucosal barrier. Lower Akkermansia has been found in patients with diabetes, obesity, inflammatory bowel disease. So important for us to see that the detail of all these species. And it's significantly more prevalent after weight reduction, which is interesting for those of you with patients looking to or who have lost weight. And then it does decrease with a low FODMAP diet, just based on the restrictions. Okay, So we're done with the beneficial microbiome section of the GI360. We've gone through our 2.5 pages and our summary sheet. Now we're still using PCR detection. We're looking for these pathogens. Very common viruses, pathogenic bacteria. You'll see the benefit of using PCR, and then later on with pathogenic bacteria, we're actually culturing as a double check, and 3 parasites. Speaking of parasites, we have a full parasitology report next. This covers O&P, of course, has many different markers, and then it also has other markers. This is a yeast is not cultured, it's under microscopy, so it is a dead yeast finding. We can talk about that later. Red blood cells, white blood cells, other artifacts that we find in the stool, we report out on. Charcot-Leyden crystals are associated with parasites, just so you know. Pollen can also be in the stool. Not frequently, but very infrequently can be associated with just allergies or what the patient is being exposed to. Okay, now we're into microbiology cultures. So this report starts with culturing out many of the same organisms that we had already looked for using PCR. We are double checking our work for more acute findings with cultures. So if it was positive on PCR, and it's positive on culture, most likely we got an active infection. Imbalance or commensal bacteria are also cultured. We do aerobic and anaerobic culturing, so you're covered on both sides there. It allows a larger view. So if PCR was a specific hook for a specific fish, this is a wide net. So we are looking for whatever shows up in our Petri dish. So we have a very, very expansive library of options here. These categories automatically expand depending on what we find. So the imbalanced bacteria list could be long or it could be short. Dysbiotic bacteria is usually imbalanced bacteria that has gone on too long and then now flipped into a status of 3+ or 4+, and now falls into a dysbiotic bacteria category. Yeast is at the bottom, of course. In this case, no yeast was isolated. And then the last section of findings is our stool chemistries. We start with digestion absorption markers. You can see the 3 markers there. And I'll go over these in detail with the case study. Inflammation markers, you can see lactoferrin, lysozyme calprotectin, secretory IgA, and then the short-chain fatty acid panel that correlates directly with the beneficial microbiome and soluble fiber intake. And then our intestinal health markers of pH, beta-glucuronidase, and occult blood. So that's an overview. You may already know this, but the short-chain fatty acids are produced by the beneficial microbiome. If there is a patient that is in need of support of probiotic or soluble fiber, you're going to already be directly supporting the short-chain fatty acid production. So those 2 sections, the stool chemistry section and the beneficial microbiome, play off of each other. These short-chain fatty acids are influenced by substrates like soluble fiber, polyphenols, very important for many of the functions of the gut. The short-chain fatty acids modulate the immune system, play a role in autoimmunity, metabolism, etc. And if low, can also be linked to various diseases. So if these are low, the membership is low. So that does make sense with the health of the microbiome. All right. At the end of the report, this is our cultures, but at the end of the report, once we get through the stool chemistries, we then offer you a page that looks like this if we have found any bacteria or yeast at dysbiotic levels. Dysbiotic level, 2+ or higher. Sometimes they're 3+ or higher based on the organism. Okay, so we did find here, we found a Klebsiella oxytoca, and we offer both natural agents and prescriptive agents in vitro, the patient's stool in vitro with all of these agents. We give you the sensitivity results. If you're using a prescriptive agent, we would recommend standard of care for treatment, duration, and dose. And then for natural agents, we're always going to recommend 2 of the natural agents at the same time of the highest sensitivity. So in this case, caprylic acid and the ionic silver. And duration and dose, again, is up to you. We try not to get into treatment. And then the last section of the report is this commentary section. So the commentary is going to be expanding upon the findings in small paragraphs. Any of the beneficial bacteria section that had a yellow triangle, a red triangle, or a blue triangle, anything out of range is going to be talked about here. Of course, we're going to talk about any of the findings, parasitology. So if we're finding parasites, we're going to suggest what is standard of care for treatment of the parasites and offer guidance there, stool chemistry findings, et cetera. So the commentary section is unique to the patient. Okay. This is our case study. We have a 36-year-old female, history of UTIs, complaining of watery diarrhea, 3 to 5 bowel movements a day, denies that it changes with food, indigestion, abdominal pain, says she eats healthy, looks like a lot of fruit, vegetables, no beans, and we'll talk about that, and some yogurt, so dairy. And then a typical day looks pretty basic. So in her situation, we can see her page here, the first page. This is her findings, her web. The white film, you can see, is not perfect, but what does all that mean? Well, we bounce down to the Dysbiosis index score. You can see she is within normal reference range at a 2. So we would want her to be there, regardless of what the web looks like. But you can see right away there's some tweaking that needs to be done in the area of that actinobacteria at the top, and possibly some overgrowth in some of the other areas that are beyond the green. So it's just another visual. The diversity score is a 4, which is also reasonable, 4 or a 5. So technically, even with all of her symptoms, her beneficial microbiome is pretty good. Below that, then, her GI health markers, even though it's normobiotic above, we do see her butyrate-producing bacteria are imbalanced. So that means that there is some work to be done on those species. And then we did find other things in this stool, blastocystis, some imbalances within the short-chain fatty acids. We cultured citrobacters, Klebsiella, Morganella, and Candida. So she's in luck because we found a lot. So this is something that is actionable for you right away. So within these key findings, we will give you treatment options for blastocystis. We talked about the butyrate and the total short chains and how to address those. We will give you treatment options to address the overgrowth of Citrobacter, Klebsiella, Morganella, and Candida albicans later on. This then is the walkthrough of her details. So the rest of her beneficial microbiome details looks like at the top, all 3 of these species within the Actinobacteria phylum are low. So when members are low like this, there is room for others to overgrow. So we will see some overgrowth in this stool just because there's room in the enterocyte, but we do need to replenish the bifido. Also, consider vitamins like B complex and K2 for this patient. Is stress playing a role? The next phylum is the Bacteroidetes. These are at a +1. We are not eradicating anything. Just remember, these are all beneficials. Nothing to eradicate. We're just trying to bring balance back with probiotic and soluble fiber. So the Bacteroidetes tend to overgrow in the presence of high fat, high protein, possibly some other inflammatory conditions. But again, nothing that a little bit of attention to the probiotic and soluble fiber and polyphenols wouldn't help. At the bottom of the page, the bacilli class is a little bit high, and anything that is in the red, the +2, +3 is considered clinically high. But again, the reason for that high is that we had some lows. So there is room for this back and forth. This blastocystis was found under parasitology using microscopy. It's a moderate level. So our in range would be not detected. We don't want to find this in a stool, ideally. And then would flip to our next level would be few, and then moderate, and then many. So blastocystis, you may already know, is considered a normal inhabitant of the gut, just like H. pylori at low levels. But at some point, when it starts to elevate and cause symptoms, and that we'll talk about later, such as, well, it's here, gas, weight loss, diarrhea, abdominal pain, anal itching, all of those, if those are present, the recommendation from the literature is to treat. If no symptoms, the literature does not support treatment, just FYI. It might be an indicator that we need to rebuild the microbiome to sort of crowd this back down, but in terms of direct treatment, it is not recommended in the literature. All right. Her imbalance bacteria, as you can see, is all here within normal range. We like to see 2, 3, maybe 4 species here, and she's right around there. Anything more than that might indicate that there is room in the enterocyte. So the beneficial microbiome may have allowed an overgrowth of some of these commensals that they're living together. So back to supporting the beneficial microbiome if the imbalance list is long and hefty. The dysbiotic bacteria, of course, is listed here. These are the levels that we found. These were most likely listed in the imbalance bacteria category, but then at higher levels at a 3+, 4+ in the red bar area, flipped down to a dysbiotic status. So this category, dysbiotic bacteria, is not there unless we find a dysbiotic level of bacteria, just so you're aware. And these are pretty much unlimited. We can list as many as we find. And then we did find a Candida albicans yeast at a 2+. Again, the red bar indicates a dysbiotic level, and we will provide you susceptibility testing and sensitivities for all of these dysbiotics. Just a brief note about her case. All of these organisms, including the Candida, could be causing the diarrhea. So I'm not sure which one it is, but all of them could cause it. The Candida, as you may know, at lower levels, so at a 1+, a Candida is considered a normal inhabitant of the gut. Within a healthy microbiome, you should be able to tolerate and live symbiotically with a Candida, according to the literature. Candida is associated with oral flush, vaginal yeast infections, could be part of a diarrhea rash, what they call jock itch. Lot going on there. So could also, in addition to the diarrhea, Candida albicans could be causing constipation, loose stools, gas, bloating, pain, sugar cravings, etc. So if the symptoms support treatment, we leave that up to you if it's at lower levels. If it's above, it's at a 2+ or above, the recommendation is to treat. All right, stool chemistries for this patient. We have, starting with elastase, this is where we're deep diving into these markers. Elastase, this is a pancreatic sufficiency or insufficiency marker, an exocrine pancreatic sufficiency marker. In this case, a plus greater than 500 is very robust, and there's nothing lagging in this pancreas. Fat stain, a little bit of fat being malabsorbed could be due to a high-fat diet, which also refers back to the microbiome. Some of the membership that enjoyed a higher fat diet were flourishing. So we could be talking about a dietary consult here. No carbohydrates being malabsorbed. If the fat stain concerns you, I would probably then consider gallbladder function, ask the patient about anything going on in that regard, or if they don't have a gallbladder, could be need for some digestive enzymes for that. Inflammation markers, lactoferrin, calprotectin, and lysozyme. Just as background, lactoferrin and calprotectin are both very specific to IBD. So those are the markers that the GI world uses to track and identify IBD patients. So this particular patient, lactoferrin is still within normal range, a little bit on the high normal side, but most likely elevated due to all the dysbiotic members that we found. The lysozyme, out of range, appropriate. This is non-specific to IBD. It's more specific, it's more site-specific in the gut. So we're talking about infections, which she has several. Could be as food sensitivity, could be an autoimmune condition, part of that picture. So just realize that 2 out of the 3 are very specific to IBD, and the 1 is non-specific and may indicate other things that we already see going on. Immunology is next. Secretory IgA is, as you can see, 50. It's at the lower end of normal. So this is normal. It's within range, but it could be in decline. This is either deceptively normal or normal. So normal is normal, but deceptively normal could be normal on paper due to a long-standing infection, food sensitivity issue, autoimmune condition, because this should spike appropriately high acutely. That's why our range is so wide, 30 to 275. That would be appropriate for it to spike high. And in red, that's appropriate. That's more acute. Over time, if left unchecked, this marker may start to decline. Short of any genetic reason why she's not making secretory IgA, it's being used up in the immune assault that's going on in the gut. It's anchored in the mucosal barrier. So with this sort of a finding, we might consider supporting the mucosal barrier with L-glutamine. We might also consider immune support because these are the sentinels in her digestive tract looking for invaders. So we might support it with vitamin D check, vitamin A, zinc, colostrum, anything that supports the immune system. So eradication of the problem, support the immune system, and support the mucosal barrier, sort of a three-pronged approach when this is low. Next is short-chain fatty acid. I referred to those. They're basically a reflection of the beneficial microbiome. How those members are doing is going to show up on this panel. And you can see some are high normal, some are low. Just know that your interception with the bifidobacterium from this particular patient and the soluble fiber is going to support all the members that make these products. The butyrate, though, is very low, and the total short chains are low. So this is a reflection of those poor beneficial microbiome members that make butyrate that were low, that we already saw from the first page, the green and yellow buttons. We saw the butyrate producers were low. And this is dependent upon replenishing those species and providing them enough soluble fiber. So the literature supports somewhere between 8 and 20 grams of soluble fiber a day for all of us. 8 probably being more of a maintenance level, all the way up to 20 of our total fiber. So patients need to understand that even though this patient was on lots of vegetables and fruit, that's not soluble, that's insoluble. So soluble fiber comes in the form of, say, beans, lentils, chickpeas, hummus, lower levels in bananas and onions, and you're going to be probably eating cup and a half to get to your 8 grams of those beans and lentils and chickpeas. If that's not doable, and it isn't for a lot of patients, you can use the supplement support. The 3 most heavily researched supplements would be inulin, chicory root, or psyllium husk that feed the widest variety of species too, because different forms of fiber feed different species. So ideally, we'd want to get that butyrate back up. The low butyrate, low total short chains, and that high pH below, short of having these dysbiotic members, this feels more like a constipated patient, this profile. Low butyrate, sort of increased inflammation because there's low butyrate, and a more alkaline bowel with a high pH. Beta-glucuronidase is in normal range, and the occult blood was negative. And then in her case, we're going to provide you with specific sensitivity, or all patients, we're going to provide you with specific sensitivity and susceptibility testing for all species separately, her stool, in vitro, with natural and pharmaceutical agents. I've circled the ones that came out the best for this patient: caprylic acid for the Klebsiella, and one of the 2 silvers, either one. And then there are prescriptive agents below that you can choose from as well. And then we do the same for you separately from Morganella, Citrobacter, and the Candida. The goal would be to find the common denominators across all dysbiotic members that we find, so that, of course, the pill count is lower. Rechecking, treatment options in this case, we generally choose 2 naturals. I meant to say that 2 natural agents at the same time. Dose and duration should be provided by the supplement company or your guidance, and the treatment. Prescriptive agents, of course, we're only going to choose 1 for bacteria. And then there's an antifungal approach. Nystatin usually works across many species for fungal if you're looking for pharmaceuticals. The retesting on this patient would be to go back and reculture after treatment, 2 weeks away from treatment, 2 weeks off of probiotic if you started that, Go back and retest using our microbiology profile is an option for retesting in this patient. We have many profiles to choose from. You can separately do bacteriology. You can separately do yeast. But the microbiology combines them both, and you can get a status update on how the cultures are doing from a bacteriology profile and a yeast profile. So that would be the best one. You can also tie in some of the markers from the stool chemistries as add-ons or separate a la carte items, just depending on the profile that you're choosing, to recheck, say, the secretory IgA or the lysozyme, just to see if that's gone in the right direction. So for this patient in general, we're looking at her diet. We want to focus on the vegetable, the soluble fiber, if we're going that direction with food, and her polyphenol consumption. Polyphenols have a very synergistic approach to the microbiome and to a lot of inflammatory conditions. So never forget your polyphenols. Those are the brightly colored foods: green teas, blueberries, raspberries, blackberries, blueberries. Address the dysbiosis, so those members that we found and we're providing treatment for, or the blastocystis. Obviously, we have treatment options in the back in the commentary on how to treat the blasto if that's needed, and then retest, as I mentioned. We're supporting with probiotics with enough soluble fiber of the right kind of soluble fiber, and possibly some stress reduction because of that bifidobacterium being low may imply some stress, ongoing stress going on. And then we restore the mucosal barrier. Could involve some dietary changes again if she's still on inflammatory foods or gluten. Other supplementation is listed here. And then nutrients that would then support other areas like immune system for zinc, L-glutamine, again, for the mucosal barrier, et cetera. Okay. I think that's it. Angie, do we have any questions that had come in?